Doctor shortage in the Central Valley is leading to a controversial choice for one community health clinic. And now clinic leaders and doctors are at odds over how to solve the problem. One of those doctors emailed us here at To The Point asking us to look into this story. So ABC 10's Becca Habegger went to Modesto to get answers.
Golden Valley Health Centers provides healthcare services to underserved communities at 47 clinics throughout San Joaquin, Stanislaus, and Merced counties.
We care for more than 160,000 patients.
Dr. Eduardo Villarama is Golden Valley's chief medical officer and explains 85% of all patient visits are Medi-Cal patients.
And the people of color in the underserved communities are our primary clientele.
But recently, Dr. Villarama and other Golden Valley leaders announced a change at one particular clinic, Women's Health in Modesto. For years, the clinic has offered labor and delivery services, meaning a pregnant patient getting prenatal care here will have their baby delivered by the same doctor or group of doctors. But starting May 1st, labor and delivery services are going away.
Women are going to die. Babies are going to die.
Dr. Susan Podolsky reached out to ABC 10 with concerns. She and three other healthcare professionals, two of whom work for Golden Valley's Women's Health Center, sat down to discuss why they're opposed to the change.
Who's going to take care of the patients in the hospital? Who is going to perform gynecologic surgeries?
Dr. Lloyd Lee is one of Golden Valley's OBGYNs affected by this change. Golden Valley says with its staff spending so much time at the hospital doing labor and deliveries, some 1,500 to 2,000 per year, they cannot meet the growing patient load demands for care at the clinic.
Our doctors that are meant to be seeing patients in the office are ending up at the hospital for deliveries. So patient appointments are then canceled or rescheduled.
He and this group agree a doctor shortage is a major factor. If there were more doctors to meet the demand, clinics wouldn't have to cut services.
We live in an OBGYN desert.
We had a hard time recruiting. The doctors are not around.
Dr. Sylvia Diego is the former chief medical officer for Golden Valley. She now has her own practice. She and these others think cutting labor and delivery, and therefore leaving pregnant patients to figure out where to have their baby, is not the way to address the problem, especially with just 90 days notice.
There's that break in the chain of the continuum of care.
I don't believe that is caring for your patient, because you can't just take care of them in the office and then drop them off.
Maria Obispo is a nurse practitioner at Golden Valley's Women's Health in Modesto. She says many patients are high risk with complicating conditions like diabetes and high blood pressure.
Where are you going to go with your cancer, with your bleeding, with your seizures?
Dr. Villarama says Golden Valley is partnering with Doctors Medical Center across the street from Women's Health.
We have built this strong partnership with the hospital leadership to assure a safe patient handoff and continuity of care.
This group is asking Golden Valley to at least delay the change. Villarama says every day they delay, Women's Health isn't able to fully serve patients at the clinic. Becca Habegger, ABC 10.
Golden Valley Health Centers receives federal funding in exchange for providing primary care to underserved communities. So we asked whether federal funding concerns under the Trump administration factored into the decision to cut labor and delivery. Golden Valley says no, that this change was all in motion well before the election. We did confirm today that Golden Valley leaders traveled to Washington, D.C. last week for a conference, and they met with congressional leaders, stressing the importance of ongoing federal support.